Welcome back, everyone. We talk so much about mental health concerns on the news, and we're seeing so many of the negative consequences of not addressing mental health problems. A local center has a specific mission and a message, and that is, you are not alone. Seeking professional assistance is a courageous step toward achieving and maintaining optimal mental health. If you had a broken arm or a leg, you would immediately go to the ER. Gladys Johnson-Ramsey is the director of Lamar Mental Wellness Center. And Gladys, you cannot say it enough. If you're experiencing a mental health situation, call somebody.
Yes, absolutely, Jenny, absolutely. And I even equate it to diabetes, heart disease. When you notice something is just quite not right, you immediately call your primary care physician, you immediately go to the doctor, you immediately set an appointment. And the same thing with mental health. If you notice something is quite not right, that stage one where you know, I'm not really acting my normal self. I probably need to watch out and see how this transpires. You know, 50% of adults anyway, we all have some kind of time in our lives where something precipitates and happens that, you know, you say, oh, I'm a little depressed from that. You know, what do I need to do? But when it continues past that first initial stage, maybe into 3 weeks of not coming outside, not talking to anyone, not working, and not working leading to not paying your bills, which leads to something else, which can lead to homelessness, then we need to probably check it out and say, what's going on with
I call
us?
that kind of cocooning. When you're cocooning, that's a little red flag there. Now, the Lamar Mental Wellness Center is an addition to the medical center there.
Absolutely. Lamar Medical Center has been there, oh gosh, since the late 1900s, 1993. And they also have partnered with the Medical Center of Augusta. They're an educational partner with them.
Okay.
So we added on because we were seeing the need for the mental wellness, for, you know, getting to those people who may be having some mental health concerns.
That's what I want to ask you next. What are the mental health concerns that you are seeing right now?
Major depression. Oh gosh, anxiety is high.
Oh, yeah.
And you know, with the times that we're living in the society, anxiety is high because people don't know, especially with Medicaid and Medicare being looked at so great, that am I going to be cut off from that? And that brings a lot of overwhelming thoughts.
Yeah, that uncertainty leads to anxiety.
Yes.
I think so much too still goes back to the hurricane. I mean, we're coming up on the 1 year.
Yes.
I think that rocked so many of us because, we just saw how vulnerable we are, that there are things we cannot control.
Absolutely. And you know, we have kind of went past talking about COVID, but COVID and then the hurricane and those people who did nothing in COVID time to address mental health concerns, they're still in that. And then the hurricane hits and it's like, oh my God, what next? Yeah.
That's a really, really good point. So what do you see in terms of local demand and some of the gaps in services?
Oh, the gaps are, we don't have enough mental health professionals. I looked at I had an article from Psychology Today that talked about the people who are in school now getting their master's or their PhDs, and less than 15% African Americans are achieving those degrees. Sadly, you have those indigenous people who are getting their degrees, the Native Americans, the Asians, but the percentage is still very low. Caucasians high up in the 50% are getting their degrees in master's and PhD, but the people of color are not, you know, that's not their majors anymore. It's less, like I said, less than maybe 11% of people in my population that are getting their degrees with mental health and in master's or PhD. And so it's a big gap there.
Do you find that's part of the issue? Is it maybe that people, African Americans would be more comfortable talking with other African Americans?
Absolutely, absolutely. I find that You know, some people, they really don't care. When they know they need help, they know they need help. But what we try to do at Lamar, because the population of the doctors, the primary care physicians, they are African American. And so we try to warm transfer them to me. And when they see their doctor and they are comfortable with their doctor, and the doctor says, hey, I think you may want to go see Gladys Johnson-Ramsey, and they trust them. And so they've been seeing them forever, and so they trust them, and they're the same color they are. Unfortunately, we got to say that, that they will say, okay, I'll do that, you know. And so, but it's still, when we think about Richmond County, it's 206,000 people in Richmond County only, and 1/4 of them, what is that, about 50-something thousand people have mental health concerns. And they're not getting the help that they need. And so we're trying to abolish that. We're trying to say, hey, we have someone in the community that will see you.
When you're talking about the things that are the red flags, you're talking about people that feel down, depressed, hopeless, struggling with sleep issues, reporting little interest or little pleasure in their daily lives, feeling tired or low energy, experiencing poor appetite, or on the flip side, overeating, having trouble concentrating, and sadly 4% reporting suicidal thoughts.
Yes, and what's the unfortunate thing about that is our youth. Our youth, we've had 10, from what I've seen reported, 10 youth between the ages of 14 and 25, those are young adults, of course, have committed suicide because they don't feel like they have anybody to talk to. And that's sad. We don't want our generation to disappear like that.
You accept most major insurance and Medicare and Medicaid and the benefits for veterans.
Yes, and I would love to see my veterans, being a retired veteran myself, I would love to see my veterans. We accept TRICARE for life, and most veterans know what that is. That's the retired folk. And then the TRICARE, the other TRICARE insurances, they have to get a referral from their physician, or their primary care manager. And we'll be able to see them also.
Gladys Johnson-Ramsey, it is so important what you're sharing with us today. Thank you so much for coming on the show, and here's the information you need to know. The Lamar Mental Wellness Center is located at 1448 Lee Beard Way. That's in Augusta. The phone number there is 706-550-5421. Most major insurance, Medicare and Medicaid are accepted.